Good afternoon to you. Before I start, I want to congratulate Minister Helen McEntee on the birth of her baby, Michael, Shane and Paul, today. This House hasn't done it to date, and I'd like to put it on the record to give her congratulations on the birth of her son. Yeah. So I welcome Mr Byrne into the Seanad and thank you for taking the time to listen to our statements on such important topics of public concern. I want to thank the leader of the Seanad, Regina Doherty, for organising this debate and for acknowledging the need for the debate on the topic which I broached during the order of business on the 26th of April. Against the backdrop, there are two strands to Ireland's stated and reported plans for vaccinated type certificates which need to be considered. The first one is the EU COVID-19 certificate and then the domestic vaccine passport system. I understand there are pros and cons for the introduction of the COVID vaccine passport of some description. I agree that we must consider any solution, technical or otherwise, that might help to navigate our way out of the different levels of lockdown and return to normal life. The digital green certificate is being presented as a solution to facilitate travel, and on the surface it would appear to provide some reassurance. I just wonder if a COVID passport is really necessary, or if it will actually help prevent the spread of the disease. It is interesting to note that the International Air Transport Association believed that they are not necessary and that the World Health Organization has expressed doubt about them too. Naturally, I want to see the reopening of the country to travel, tourism and social and sporting events and public gatherings. On the other hand, I have real concerns about the introduction of a COVID vaccine passport that could result, either now or in the future, in discrimination, surveillance of some description, or that would impinge on the unjustifiable way on fundamental rights and freedoms that every citizen should enjoy. Ireland is not a paper-carrying country, and nor, in my considered view, should we ever become one. On a cautionary note, we don't want to see the introduction of any type of health passport, health database or ID card by stealth. When a new power or technology or something like this is introduced, there is almost always function creep. History tells us to be careful about sleepwalking into a situation where we label some people as being clean and others as unclean or potential vectors of disease. Equally, we need to be careful about the state making promises to keep people safe in exchange for accepting more state control over their lives. The Patriot Act, which was passed in the US after 9/11, and the unconstitutional mass covert surveillance of the American people by the National Security Agency is a case to point. The fact that some people in Israel have taken to wearing a gold star as a symbol of opposition to the Green Pass regime there is a stark reminder of history too. Of course, the EU Parliament has recently approved the digital green certificate, and it is to be up and running in the EU in June. By the end of June, I understand the government target is to have over 80% of the population vaccinated with at least one dose. So virtually everyone at risk will either be vaccinated or had vaccines offered to them. Effectively, we would have reached the point of herd immunity. Given the efficacy of the vaccine, one would anticipate there would be virtually no hospitalisations or deaths attributable to COVID-19 once that percentage of the population is vaccinated. Would it really be a significant risk to public health, therefore, if somebody with COVID-19 entered the jurisdiction without a green certificate when the population was vaccinated and had acquired immunity? Logic would suggest not. With uncertainty still surrounding the length of time immunity lasts from the vaccines, and uncertainty also around the ability to transmit the virus after being vaccinated, I wonder how much use is the green certificate as a reassurance that the holder of the certificate is not prone to being infected, or more importantly, that they will not spread infection. Certainly those who test negative in order to obtain a green certificate and who are not yet vaccinated are vulnerable to the infection and, upon infection, likely to spread the disease. I wonder to what extent is private enterprise involved in the Digital Green Certificate programme? What is the cost to the state? What is the evidence-based explanation to the effectiveness and necessity of the Digital Green Certificate to stop hospitalisations and death? Therefore, while some of the questions above in respect of the EU certificate also apply to any proposed domestic certificate, I outlined the concerns and questions that I have in relation to a domestic cert. Will the Minister clarify what measures and initiatives are planned in respect of a domestic certificate system in Ireland? How would any domestic system work? What would it be used for? What would the legal basis for a domestic vaccination passport system be? A domestic vaccination certificate would lead to discrimination against people who are awaiting a vaccine, who cannot receive a vaccine for medical or disability reasons, or people who simply do not want the vaccine. How would the Irish authorities safeguard against this? How would such a system comply with Article 7, privacy, and 8, protection of personal data of the European Charter of Human Rights? How would such a system comply with Article 6 of the GDPR 10? How will it comply with the principles of effectiveness, necessity and proportionality? In recent media reports, Deputy Oisin Smith said that the pilot system on digital passports had been running with a sample group of healthcare workers over the last couple of months. Who is running this pilot scheme? What are the details of that pilot scheme? Has a data protection impact assessment been carried out? Will the data protection impact assessment be published? Notwithstanding my questions and reservations about the Digital Green Certificate issue, I am somewhat reassured by the fact that the MEPs agree that the system should be no longer in place than 12 months. The document should neither serve as a travel document nor become a precondition to exercise the right to free movement, and also that in order to avoid discrimination against those not vaccinated and for economic reasons, EU countries should ensure universal, accessible, timely and free of charge testing. Thank you, Minister.